Okay, we are good to go. I want to welcome Dr. Chris Blevins from K-State College of Veterinary Medicine. Dr. Blevins received his master's degree from K-State in 2004 in Animal Science and Industry and graduated from the College of Veterinary Medicine at K-State with a doctorate in veterinary medicine in 2006. Following graduation, he did a large animal and equine internship in Indiana at Janssen Veterinary Clinic and Purdue University Veterinary College. In 2007, he became an associate veterinarian at a mixed animal practice in Savannah, Missouri. And Dr. Blevins joined the faculty at Kansas State University in 2009 and is currently a clinical professor in equine field service, and his primary interest is in equine preventative care and management, including equine dentistry. So we're excited to have him join us this evening. I will remind you all to go ahead and keep your microphones muted and your cameras turned off. That just helps us with the bandwidth a little bit tonight. Also remind you that if you have questions, feel free to put them in the chat throughout tonight's discussion, and then we'll address those at the end. And if you don't think of your questions till the end, we'll ask them at that time as well, and I'll be monitoring the chat as we go. We would ask too that once you complete tonight's webinar, that you go to the link where you registered for this webinar and complete the survey. That just helps us to make sure that we're providing information that's important to you, and we can bring you additional information that is valuable. So with that, I'm going to go ahead and turn it over to Dr. Blevins.
All right, thank you, Kelsey. Can you hear me okay and everything's coming through all right? All right, good. And I don't know, I'll probably end up sharing my screen here, and we'll kind of go through a little bit of kind of information on a few things that, you know, a lot of people want to know about, and what we can use in a day-to-day basis, and it has to do with equine vaccines in addition to general health. And we'll kind of go through that, and I'll probably just see if I can stop my video over there. That way I'll help a little bit with the bandwidth that way too. There we go. And we'll just kind of continue on. And yeah, if there's extra questions, we can sure kind of answer those as we go or at the end. That is fine with me, and sure appreciate Kelsey having me here. I was in 4-H when I was a kid, and really appreciate and have kindness for that of education and through that of 4-H. So let's get started. So equine vaccines and general health, catering for protection. That's what we're going to kind of go through here today. And with that, it should be something that we can, there we go, go through, and we'll go through the differences of horses, core vaccines versus risk type vaccines. So we'll go through that in horses, and so you kind of understand a little bit about that. Test and travel. So what can you do and what we should do with our horses when it comes to that. And internal parasites, we'll definitely hit that topic. A lot of horse owners and you know, young 4-Hers have questions about that, and then ending with some oral health and dentals and what that kind of involves for the horse. So in general, encompassing and keeping our horses healthy. So the differences of horses, you know, young foals starting at 4 to 6 months of age, we actually start vaccinating them. And so that is important to remember as far as how and when we should start protecting these foals. And that starts usually when we wean foals. And so that is an age frame to always remember. And the other thing is, once you start vaccinating a foal, you can't just give one shot. You got to come back in about a month or 3 to 4 weeks and give that second shot, just so they get a booster stimulation of the immune system. And really, if you don't come and booster that second round of shots, you're not doing a very good job in protecting them from disease. So again, all those things are important when we talk about foals and when we would think we need to start vaccinating them. And that usually starts at a fairly young age. Usually, again, when they're getting weaned. Maternal antibodies, and they start making their own immune system. Remember that when a foal is born, they get all their immunity or protection from disease from their mom and from the milk, or what we call the colostrum. And that helps protect them during their early stages of life. And then they'll start making their own immune system over time. And so all that stuff is very important. And I just put this chart here. It's really what I go over with the veterinary students, but it does help for, horse owners to understand these things too. And what this kind of graph is showing is that we do like what we call an IgG snap test or a blood test on the foal after they've ingested the colostrum to see if they have enough antibodies or protection from the mom when they're first born. And so it's a little snap test that we do. And we want it to be over 800 as far as a number. And if it's less than 400, we call that failure of passive transfer. And so that means that the mom's milk was not good and did not have enough antibodies to protect the foal, or the foal just didn't ingest enough of it. And so there's things that we can do to help protect the foal in those realms too. And veterinarians can draw some blood on the foal, usually about 6 to 12 hours after they have nursed the first time that we could do this blood test. But even with that, there's still kind of troughing of antibodies and a weakness of potential immunity, or naturally more exposure of disease could cause a problem with them getting sick between the 5 to 15 weeks of age. So when they're about a month, to 2 months of age, they're more likely, or they can be more likely to get sick, even with good, adequate maternal antibodies and making their own immunity. So things we can do to help protect them, right, and decrease the exposure to disease on these foals during that time frame. So older, mature horses greater than a year of age, they're going to make their own immunity, right? And whatever they're exposed to, and immunity helps protect them from disease. Most of the antibodies, when we talk about vaccines in horses, last about 12 months or 1 year. We do not have like a 3-year or 5-year rabies vaccine like they do in dogs and cats, but we do have vaccines that will last for a year, but we still have to booster every year in order to protect them from disease with these vaccines. Cell-mediated immunity, that just means that kind of big terminology that if we would have, horses that would have modified live vaccines help stimulate the immune system a little bit more or better than just a killed vaccine. So talking to your veterinarian and figuring out what vaccine would be best would also would be the aspects of looking at modified live and which part of the immune system can we stimulate to protect them. So just getting a basis of that and understanding is important. Then we talk about brood mares, going back to the mare that has a foal, right? And brood mares are mares that have those foals every year. We're trying to as a goal. And so we want to make sure any vaccine we give them is safe for them and for the fetus. There are modified live vaccines actually that if you would give to a gestating mare, so a mare that has a fetus inside of her uterus, that could cause an abortion, just the vaccine itself. So we want to make sure that whatever vaccine we use is also safe for them. And talking with your veterinarian and discussing these things is going to be important. In addition, when to vaccinate the mare, it is actually best to vaccinate her 1 month prior to foaling, and that helps get antibodies up in her system. And then the last 2 weeks, it gets into the colostrum. And remember, we just talked about the colostrum, or the mare's milk for the foal. That's what really helps in protecting those foals. And so to do that correctly, you actually have to vaccinate that mare prior to her foaling. And so again, talking with your veterinarian, figuring out the best time to do that and with what products is going to be important. Stallions, the other thing too, trying to protect and make sure they are staying healthy throughout the year is something we need to think about too. These stallions are used to ship out semen and to breed mares, and they're fairly valuable as far as what they're worth for those owners and barn managers. So keeping them healthy is going to be important. Even communicable diseases or diseases that can be transmitted from one horse to the other horse by just nose-to-nose contact. It's kind of like us going into the grocery store or going to a child's daycare where there's a lot of commingling and a potential of disease. The same thing with any of our animals, including that of horses. That kind of commingling can cause disease too, and so trying to protect them is going to be important. So it would be ideal to have what we call a closed herd. So nothing comes in, nothing goes out. It's all the same horses, just with themselves, or nothing else is coming. No new horses. Nobody is leaving and going to a trail ride or going to a horse show. Nobody's leaving the farm and petting another horse and then coming home to their own horses and touching. That would be considered a closed herd, right? It's kind of all in, all out, secluded aspect, and really tough. We do a fairly good job with this for swine, so pigs, and for chickens in their barns with closed herds, but we really don't see this for horses. A lot of the times, here's what we're dealing with, right? So horses leave the farm and they'll go on the weekend to a show or to a 4-H show and horse shows, and then they come back. And so they could bring disease with them. They could become sick, but also they could make sickness for the other horses that are there. So knowing those things, we know that we need to try to protect all the animals that may be encompassing or in contact with those as they're leaving and coming back to the farm. Usually I can help with these things, and as veterinarians, is managing the farm and talking with the barn managers and quarantine areas or areas that we can have where some horses are in certain areas and other traveling horses are maybe all commingled together in another barn separate, and it's not just a fence but a 20-foot barrier, so there's no nose-to-nose contact. For example would be like those mares with foals by their sides, and that could, we want those foals to stay protected. So put them out in a pasture somewhere away from other horses that are traveling and competing could help minimize some of that based on exposure. So things to think about based on disease, even vaccines, but just, contact with different horses as they're moving. Now, if we go to vaccines and what we can use for horses, there's a lot of different combination vaccines that we kind of think of when it comes to that. And we first start with what we call core vaccines. So every horse should get these vaccines every year, no matter if they're around other horses or not. And so when you look at the list of these diseases, these are usually in those combination vaccines, but if they're not, you need to look through and make sure they are, because this is what's recommended that every horse gets every year. So it has tetanus in it. It has Eastern and Western equine encephalomyelitis, which we call sleeping sickness, those two viruses. And then another virus is West Nile virus and rabies. And so with that, any of these diseases are pretty bad if a horse would get this anyways, make them really sick. They could even die for sure, but we can sure protect them based on vaccines. And then there's a lot, I just kind of put a few, there's a lot of companies that sure make vaccines that have a lot of these core vaccines. A lot of times the rabies will be in a different vial. There are some. There's one by Zoetis that actually has the rabies with the rest of the combination. But again, talking with your veterinarian, you can sure look through and gather some information on this and understanding what core vaccines are and why a horse should be vaccinated for these. So tetanus, just kind of going through these individually, kind of really quick. Tetanus comes from the dirt, and so it's hard to prevent horses from being on dirt, right? But when they get wounds or they get a hoof abscess, we put tetanus high on the list of a possibility of causing that kind of a problem. And so horses are sensitive to this even more than us. We get tetanus shots too, right? Maybe you've heard of that. But horses, they'll get this every year, but they're even more frequent if they get a wound. Foals and weanlings, we're going to start again when they're weaning, but if they didn't have in the colostrum, we may have to start them earlier, and then we'll booster them adults. It is a killed vaccine, so safe to give to a mare when she's in gestation or has a baby inside her belly. So that would be perfectly fine to give a tetanus, and usually 1 month prior to foaling, and then annually. And the other thing you need to remember, like if you ever have a horse that has a wound or an abscess in the bottom of its foot, and if it's been greater than 6 months since its last booster, it's probably best to booster again and talk to your veterinarian about that and getting those things done appropriately too, so your horse doesn't get tetanus. Because if a horse gets tetanus, they can sure die. They get really rigid, and they could quit breathing. And so all those things are important to understand and to know when it comes to tetanus and how we can protect our horses based on vaccines and where it comes from. So another one here is Eastern and Western equine encephalomyelitis. Those are two different viruses, but they're in the same class of viruses causing disease in the horse. And so we call them the sleeping sickness that you may have heard of. Mosquitoes are the vector, and so mosquitoes are what transmit it to the horse and to people. People can actually get these diseases, so they can get Eastern and Western equine encephalomyelitis, but they don't get it from horses. Horses are dead-end hosts, and so are us as people. So if we get sick with this, we cannot transmit it to another person or to another horse. And the same thing for horses. So we get these. It actually comes from birds, then to the mosquitoes, and then to us. And so again, just important to kind of understand and know, and it's around. So it's hard to keep a horse from getting bit by a mosquito, so we need to make sure it's in that core vaccine. Another one that's in the core vaccine we just talked about earlier there is West Nile virus. It's also a virus that is mosquito vectored. So mosquitoes are what inoculate it into horses, but they also, for us, people, can get West Nile. And so the CDC, which is a governmental agency that keeps track of disease, they will keep track of West Nile and even the aspects of human cases, horse cases, and how many mosquitoes that are transmitting it within the United States every year. And so this map is just showing that as an example for 2021, and knowing that West Nile is across the board and around in the United States. So it's here, and we just need to make sure we're protecting horses from this disease. The other one is rabies. So rabies is very crucial and very deadly. If an animal and even us get rabid or rabies, that will lead to death, usually within 10 days. So it's good not to get this disease for sure. It can be transmitted to people, and people have died. And a lot of these, even like 55,000 human deaths per year, usually seen in Asia and Africa, due to rabies. So that is just unremarkable, the amount of disease that can happen for people. We don't see that in the United States very often because we have post-exposure vaccines for us as people, but then also we vaccinate our dogs, cats, and other animals that were around to try to minimize that exposure of rabies. Looking at this map of Kansas, this is from the rabies website, and they keep track of different species that are positive for rabies within the state and based on counties. And so wherever you're at here in Kansas, you can kind of see, what animals have been positive. And this is just 1 year in time. Most of these are red dots. And so skunks are the terrestrial reservoir in the Midwest. And so skunks are more likely to have rabies around here. So if you see skunks or any nocturnal animal out during the middle of the day and stumbling around, it's probably rabid, and so be careful. And then there are other species, bats, horses. Horses, even in Kansas, every year die of rabies. So again, this is why it's important to make sure we vaccinate horses for this disease. And with that, we'll get into risk-based vaccines. So now it's going to be anything else I discuss is going to be based on risk. And so it doesn't necessarily mean that every horse needs to be vaccinated for these other diseases we're going to talk about, but it's sure something you've probably heard of. Consulting your veterinarian when it comes to the rest of these vaccines to see, should I vaccinate my horse for this or not? It's going to be based on that individual population and geographic region or location, because there's some diseases that are seen in certain parts of the United States and not in others. And so we'll go through and see some of those. Probably the most two common things that we do as far as risk-based vaccines for the horse that you maybe have heard of is the equine herpes virus, which we call rhino. Maybe you've heard the term rhino. And it's a communicable disease, so it can go from horse to horse. Upper respiratory, so they get kind of a snotty nose, but they could get neurologic, so they could stumble around with that virus, and they could lose a fetus, and so they can have abortion too due to this virus. And so that's important to know that these, and there's different types of herpes virus for the horse, but is possible. And then influenza. Horse influenza. It is, again, communicable, so it can go from horse to horse. Usually stress the immune system will cause the disease more likely. It is respiratory, and they can get a fever up to 106 degrees Fahrenheit. So they can get really hot. Most horses normally are going to be between 98 to 100 degrees Fahrenheit. Once they get over 102 degrees Fahrenheit, we consider that a fever in a horse. And so again, important to kind of remember. So there's different vaccines that we have for rhino flu, and veterinarians usually will use this. And so will owners for their horses and vaccinate. Usually every 6-month boosters would be needed for a rhino flu based on exposure. Most horses, you'll see these diseases a lot during the winter. Similar to us is when we usually get the flu. And so but it's very different. Human flu and equine flu are separate and different. Strangles, another one that we've heard of for horses. It's a upper respiratory disease. They can have a fever with that too. And it's hard to try to vaccinate once you already have an outbreak of strangles, so you can never get in front of it that way. The other thing to remember about strangles is you can have an allergic reaction to the disease even from the vaccine. And so there's a risk of the vaccine too. You want to make sure you use it correctly and safely. And even doing blood tests, if you're going to use the strangles vaccine for the first time and don't know if the horse may have an allergic reaction, talk to your veterinarian. There's a blood test that can be done before you want to give that vaccine. And then there's an intranasal vaccine that's a modified live. You squirt in the horse's nose. But if you ever use this or you're giving the vaccine, always make sure this one is intranasal only. Never give it into the muscle, because this is a bacteria. So what happens if you inject a bacteria in the muscle of a horse or any animal? You get an abscess. And so we have to be careful with this vaccine. In addition, if you give this intranasal vaccine to a horse, most of the time what we do as veterinarian is we give all the other IM injections first and then give this intranasal vaccine, because they'll blow it out and aerosolize, and you can get indirect injection into muscle if you have still other IM injections you have to do. So those kind of risks too are stuff we need to keep in mind when using this vaccine. And those are kind of the more common ones. There are sure other ones based on different regions, and we didn't really go over like Potomac horse fever and other aspects of things based on location. But again, if you're traveling, just kind of keeping those things in mind and traveling. So it leads us to this, and maybe you've seen this or had this done to your own horse, and it's the Coggins test. And sometimes then we'll write health certificates. So the Coggins test will check for a certain disease we're going to talk about here in a minute. It's a virus, but it is legally needed, say, if you're going across state lines, to get put on the health certificate. And the health certificate is going to be good for 30 days. And that means that your veterinarian has looked at the animal and found it to be free of infectious, contagious diseases on that day 0. But the health cert is still good for 30 days legally, but just wanted to let you know that it is important to make sure the veterinarian looks at the animal to make sure it's healthy to write the health certificate as you're traveling. Because if you don't have this paperwork, in some instances, you can be stopped by regulatory people in different states, and they can quarantine your animal or even fine you, or both, for not having this type of paperwork and stuff as you're going to different states. So when we do the Coggins test, kind of going to that part, what is that? So it tests for equine infectious anemia. What is that? So what that is horse AIDS. So like HIV in people, it's the same type of virus. It's not the same virus exactly, but it's in the same class. So this one is horse AIDS. And so we do not have a good vaccine for equine infectious anemia. So how we control it is based on testing and blood testing. So this is what we're doing. So it is bloodborne. Biting flies can transmit this disease from one horse to the other. So can dirty needles. So never use the same needle between horses, because you could spread this disease quickly. And that's usually what happens when you start to have an outbreak of equine infectious anemia on a farm. More likely they had the same needle they were using between horses. Acute, recurrent, and chronic phases of the disease. And so they're persistently infected. Once they have this disease, are always going to have it. So that's important to know. And again, it's the Coggins test. And what happens to horses that are positive? Well, it's reported to the state veterinarian, and the state veterinarian would make the recommendations whether to quarantine or to euthanize or to put down that horse based on the disease. So again, important to know and to understand what this is and why we are testing horses is important. There's a lot of different companies, even digital companies, that actually help veterinarians in making or doing Coggins tests and health certificates. And with this, it's digital. So once the veterinarian does it, then the client can go onto a website also and to view this paperwork as a PDF and then print it themselves. So these things sure help in making things fairly efficient. And if you ever lose your one copy, you just go back online and get another copy pretty quick. And so all these things are kind of important to know and to understand. And the veterinarians are also using these digital formats to be able to do Coggins and health papers and even passports, which are health papers that last about 6 months as they travel in different places too. You can sure ask your veterinarian about any of these if you have any questions as you're traveling across state lines. Even as you travel, another thing that's important to know is that the Coggins test, we do have positive horses in the United States. And if you want to know what's kind of going on into a state, maybe you're traveling to go trail riding or to a horse show, you can go to the EDCC website. So right here, you can see right there, this is the Equine Disease Communication Center, so EDCC. They have a website you can for horses, and you can look to see what diseases are popping up in that state that you're traveling. And so doing that and consulting with your veterinarian can sure help protect your horse as you're traveling there, and to understand and just being prepared. All those things are going to be important, but it's a great website just to think about and to have, especially if you're going to be traveling, and to look and see what's going on. You know, we're starting to have some West Nile cases pop up in different aspects of the United States. This is just showing Coggins tests, so positive Coggins horses, and where they're at currently on that, and when it happens. So you can read more when you click on certain states about what's going on of that. So it is a great tool to have as you're traveling with horses. Now, going to that of internal parasites quickly here, remember that how horses get worms inside of them, right? So internal parasite or internal worms comes from eggs that they get pooped in the pasture. The larvae develop on the grass. The horse eats the grass, right? The larvae, most horses aren't eating poop, but the larvae hatch out and they get on the grass. And so that's kind of how it kind of circulates through. And then obviously once the horse eats the grass, then those larvae get into the horse. They develop into mature worms, and then those worms lay eggs again in the poop. So it's just a cycle that they go, and this is how we need to try to understand this cycle and how to help control internal parasites in horses. And we start talking about deworming, right, and how we need to deworm our horse. So with this, again, everything is fecal oral when it's usually kind of blades of grass as it goes. And horses, if they have worms, what will they show? Maybe it's weight loss, maybe they get colicky, maybe they have diarrhea. And so with those, two of the most common ones that we'd see would be ascarids, and these are seen in horses less than 3 years of age. As they get more mature, they're less likely to see ascarids. And then small strongyles is another one in any age horse that could have an issue with. So just understanding those things are going to be important, and a few internal parasites that could arise. So the treatment is, deworming. But you have to remember that a lot of people are over deworming their horse, and we're going to be starting to see, and we are actually seeing resistance to dewormers because people are over deworming their horse. And so we want to make sure that we don't kill all the worms off. That's not the goal. The goal is just to manage the worms. And so talking with your veterinarian, running fecals, and then deworming accordingly. Try not to use daily dewormers. Trying not to over deworm your horse if it's not needed, because we don't want to cause super worms. To only ones that are surviving are the ones that can kind of resist these dewormers that we have. So it's important to use your veterinarian, consult with them about running fecals and deworm accordingly. Some horses, they just need dewormed once to twice a year based on their fecals. So that's important to know also. Ending here with teeth. And so horses have very interesting teeth. They're hypsodontal teeth. They're very important. Remember that horses, they graze 16 to 18 hours of a 24-hour period. So while they're awake, they're using their teeth. So their teeth are very important. They're grazers. They got to chop up the hay so then they can swallow it and use it for energy. And so with that, these teeth are very valuable to the horse and needed in a day-to-day basis. We call them hypsodontal teeth, meaning that these teeth actually erupt throughout their whole life. So the teeth don't just stay one size, they're actually continuing to grow, but then they have wear that's happening at the same level. And so that's why the teeth don't get any longer, what you see, because they're having the same amount of wear. And they also have angles to their teeth. Those cheek teeth, they're not just square in there, and that's important based on function. And veterinarians are usually, when we're doing an exam, we're kind of knowing these things, knowing the anatomy and how we can help with function of the teeth based on an oral exam and potential treatment. So foals, normal bite, make sure they don't have, conformational defects. So we talked about like parrot mouth and sow mouth and rhinos. Some of those things we'd be looking for in foals. Young horses, twice a year exams would be beneficial. Now, most people don't do that in young horses, but it's sure better to be proactive than reactive, depending on what we find in the horse's mouth. Remember, it's very dynamic. They're losing their baby teeth. They're getting their permanent teeth. So getting in there and looking in the horse's mouth can sure head things off so they don't get any worse, as they do get older. Remember, it's hypsodontal teeth, so these teeth continue to change. And if they're already having abnormal wear, they're going to have even more exaggerated abnormal wear without examination and potential treatment. This one is just kind of showing a picture of a middle-aged horse, 5 to 15 years of age. Just once a year exams, again, is important, but it also is based on their diet and what they're eating, or maybe they already have problems. And so you can see this upper right picture is just showing a picture of a horse's teeth. These are the cheek teeth. There's many of them, even though one looks like one long tooth. These are actually multiple teeth sitting in here, big blocks, and they're rough, and that's used to kind of chew up roughage. So this is the upper left cheek teeth, and here is the lower left cheek teeth. And here's the tongue kind of sticking out to the side here too. So this is looking inside the mouth. You can see these ridges of the hard palate kind of setting up through here too. Those are kind of more normal looking middle-aged horse teeth. Now down below, this one is more of a geriatric or an older horse teeth, missing different sections, having some teeth that are a little bit longer than others. And so again, doing exams on these based on wearing out or having loose teeth is going to be important for a veterinarian to look at those and to make kind of minor changes over time with the dental, but also diet. And so if they start to lose their teeth, then we got to change their diet to more processed feeds. And when they don't have cheek teeth, it doesn't mean that they're just going to die. It just means we're going to have to feed them differently. And so again, those things can be managed based on the examination and with treatment. So this is just showing you how we do dental exams in horses. We have stocks that they stand in. We sedate them and they just rest their head kind of in those, and we open their mouth, which what we call a speculum. So you can see that horse's tongue sticking out. We're telling them to say ah, but that's just a speculum that holds that mouth open. And I'm using a dental mirror in that picture just to look in there, examine those teeth, make sure I don't see any fractures or diastemas, meaning spaces that shouldn't be in there, the location and the shape of the teeth. And so we do an exam and then we treat based on what we find. If they need it for pain and function, that's when we treat them. So knowledge is important on these things, and being proactive is also very important when it comes to their teeth. Let's see if this video works here. So this is a dental endoscope, and it's just showing, doing an exam. You can see the teeth up there on the TV screen. So we do this in-house, and so you can see we're examining these horses' teeth, making sure they don't have any fractures. Then we're documenting stuff on the dental exam form, writing, coloring, coding, taking pictures of the mouth, and the owner gets copies of these things too. And so all this is important of the examination. And so just wanted you to be aware of what it kind of would look like in doing an exam on a horse's mouth. And that is kind of it. So I don't know if we have any questions, or if we do later, you can sure let me know. There is one thing. I don't know if there's. Yep, that was just from earlier questions. So, all right. That's kind of all I've got. Let me video mute there. Okay. All right, Kelsey, I don't know if there's anybody else that has any questions, or anybody that made it to the lecture and has any questions. I can sure answer that, but that's kind of everything I have that includes that for horse health and vaccines.
Awesome. Well, I don't see any questions in the comments right now. We'll give everybody just a minute because sometimes we start to shut down and then we get one come in last minute. So we'll give you guys a chance to put some questions in the chat. If you don't have questions, that's great too, but we will send you an email with the survey link for you guys to complete the survey. If there are things that you want to go back and watch and need the information again, the recording of this video will also be posted on the Kansas 4-H website under the Horse Project webpage. So, and Danelle says no questions, but it was great information. And once again, we want to thank Dr. Blevins for taking the time tonight to share with us. If you do have questions, feel free to email them to me and I can get them to Dr. Blevins for you. And we wish you the best of luck preparing for your county fairs and also the Kansas State Fair. Have a wonderful evening.